Hey folks, if you clicked on this video, you probably have some type of back pain. I'm going to show you a few things that could be causing it and why spinal decompression is a good option for you. A lot of times what happens is these nerves here are disrupted by a compression of the disc, which causes the disc to bulge and put pressure on that nerve that goes to your organs, your legs, your arms, your hands. So if you look at our model here, each one of these discs in between the bones is made up of kind of like a rubbery compound. In the center of the compound there's a gel, and basically what that does, it basically acts like a shock absorber on your spine. When you're walking, you get this motion basically, and it absorbs the shock. When you have an injury, what can happen is if you have a fall or an accident, a sports injury, you compress that disc, you get a herniation in that disc, which puts pressure on that nerve. It basically disrupts the signal that nerve is sending to your organs, your legs, your hands, basically any part of your body. So if you're feeling numbness in your hands, legs, you get the sciatica with the pain down the leg, that's probably what's causing it. And if you look at this chart here, you can see that the lower half of your body controls all your lower organs and your legs. The center of your spine controls your stomach, your gastrointestinal system. Your upper spine controls your neck, ears, head, things like that. So if you're having problems, digestive problems, or you do have a problem with your spine, that could be causing your digestive problems. If you have heart problems, it could cause your heart problems. You have breathing problems, respiratory problems, that could cause your breathing problems also. So I want you to take a good look at this chart here, and wherever your spine is injured, look over here and see if you have any of these symptoms in your organs or your hands or your feet. You probably need to consult a spinal physician to make sure that they aren't life-threatening. When you consult your physician, ask them if they think that spinal decompression could help you in relieving your pain and possibly aid in helping your situation get better. At Head Up LLC, we manufacture and sell the spinal decompression device, which doesn't require inversion, hanging upside down basically where your head is below your heart. That's not always so good because high blood pressure, and it's not good for your ocular nerves because it sends a lot of blood to your eyes really quick hanging upside down. With our Head Up spinal decompression device, you're in a standing or seated position all the time, so your head is always above your heart. The weight of your lower body decompresses your spine gently, and you control the amount of weight on your spine because your feet are always on the ground, so it's very safe. Dr. David Tallman of Scottsdale, Arizona highly recommends it. You can check him out on his website. He's an award-winning doctor. He does spinal injections, stem cell injections. I've had several sessions with Dr. Tallman, and the injections have improved my quality of life for sure. Now my injury is such that I'll never be 100%, so I do have daily spinal pain, but that's where my Head Up spinal decompression device comes in. I use it 4 or 5 times a day, 2 minutes at a time, and I feel great afterwards. I'm ready to go back to work. Now folks, I'm not a doctor and I never claimed to be, but over the last 30 years, I have scoured the internet, learning about back problems, back injuries, what ailments they can cause, how to ease the pain of these things. That's specifically why I invented the Head Up spinal decompression device. I compressed the disc in the center of my back in the 90s, and I still feel the pain on a daily basis now. While the injections with Dr. Tallman helped, they weren't a cure-all because of the extent of my injury. So I had to figure out some type of pain relief because I don't take pills, I don't want to do surgery, and I don't want to have to go to a physical therapist 3 times a week. So I figured out a way that I can decompress my spine at home anytime I want, wherever I want, and on my own schedule. This is a proven method. You can see our many videos on YouTube where we were at the trade shows and people were using the machine. Every single person said that they got relief and it felt a lot better after using our device. So go get yours today. Thank you. All right, folks, I wanted to show you something I found on the internet. This is coming from the Mayo Clinic, and it says, a spinal injury can affect the vital organs and can lead to neurogenic shock, which is a combination of low heart rate and blood pressure due to disrupted signals from the brain to the spinal cord. This can result in severe complications such as orthostatic hypotension, where blood pressure drops when the head is raised, and deep vein thrombosis, a blood clot that can form in the arms or legs. These conditions can be serious and even fatal if not treated promptly. Now you can see here in some severe cases, compressed discs over time, if not taken care of, can sometimes cause paralysis. And I'm not trying to scare you, I just want you to be healthy. If you look here, it says early recognition of red flags such as sudden weakness, loss of sensation below the specific levels, bowel bladder dysfunction is critical for timely intervention preventing permanent disability. So always see your doctor if you have an injury to your back. This is also from the Mayo Clinic. So back injuries can cause numbness, tingling, loss of feeling in hands and fingers or feet or toes, loss of bladder or bowel control, difficulty with balancing and walking, trouble breathing in severe cases, especially after spinal injury. These ailments can vary in severity, and many require different treatments, including medications, physical therapy, or surgery. It's crucial to seek medical attention if experiencing any of these symptoms to receive appropriate care and support. And that's why I always say, talk to your doctor before using any medical device, ours or anybody else's. But spinal decompression has been shown to help improve a lot of these in most people. So hopefully you're one of those people. The bottom line here, folks, is spinal decompression does help. It's not a cure-all, be-all, end-all for everything, but it does help. I'm living proof of that. My wife has scoliosis, and she uses her device every single day, and she gets pain relief from it also. So do yourself a favor, go to our website and purchase one. But like I said before, always, always talk to your physician, your chiropractor, your spinal doctor before using our device or any other device, especially inversion, because you're spinning yourself upside down, the blood's rushing to your head. Our device, you don't have to do that. You're in an upright position, so you don't have to worry about high blood pressure, aneurysms, things like that. So take care of yourself. God bless.